Hello teacher and everyone, I'm Evan Chen Qiren. Today we will discuss about OCD and scrupulosity. So, what is OCD? It is the acronym of Obsessive Compulsive Disorder. Here is an example. You may go check the door again and again, but your worries still remain. It's recurring thought which make you feel anxious all the time and affect your daily life in the process are known as obsessions. People with OCD experience severe anxiety and distress. To relieve this anxiety, they perform some repetitive acts known as compulsions. So we may always think that OCD may like something happening on the TV or movie. Some people are obsessed with cleanliness and may worry that their hands are germ-infected, even if they wash their hands less than 1 minute ago. However, scrupulosity is a type of OCD, and the obsessive fear of not being good enough. And it comes from Latin word scrupulum, which means a sharp stone. Then it feels like a pebble in your brain, but you can get rid of it. And scrupulosity sometimes are called religious OCD or moral OCD. Religious OCD causes unwanted and often distressed intrusive thought related to moral, religious, or ethical issues. Scrupulosity has been documented as early as 6th century. The rabbis and parents discovered that some parishioners may go repeatedly to confession or ask them that, am I doing right? Or pray incessantly and fear not following religious or moral principle perfectly. However, OCD and scrupulosity have nothing to do with devotion. Though many people who experience scrupulosity do practice a religion, it is important to note scrupulosity can impact non-religious secular individuals too. One study found 24% of participants with scrupulosity had no religious affiliation at all.
Hello everyone, I'm Benjamin. The major symptoms of OCD is that they are unable to accept uncertainty. They will try not to make mistakes at all, and they will experience an intense amount of anxiety when they fall short. They are often overwhelmed by self-doubt and guilt. In addition, they have difficulty tolerating uncertainty. Acceptance and commitment therapy accepts the so-called abnormality as part of the human psyche and lays more emphasis on change through acceptance. The therapy helps people accept their difficulties and move on, leaving the negativities behind. The article also says that the world is not always perfect. Those with OCD can try to understand this.
There are so many people who suffer from OCD. In this vein, Leonardo DiCaprio is one of the OCD victims. As people know, OCD is the disorder commands people to accept nothing but perfection. Unfortunately, OCD didn't serve as a momentum in Leonardo's career as an actor. Instead, the disorder happened in his daily life. That is, OCD wasted lots of time that could be spent on other important things. He once walked through the doorway several times or stepped on every gum stand on the street. All these seemingly ridiculous acts are like a cycle that the OCD patients can never escape. In our life, we always search for a goal, so that we can strive for it, devoting our time or efforts. But what if something you have completed gives you nothing in return, or maybe you can't even complete it? I introduce a game, The Witness. In this game, players travel to different places on the map and solve the puzzles. The Witness has received much positive feedback, but there's a certain amount of a negative one. Most negative comments are complaining about, how can I beat the game? Not even the developer listed all the achievements in the game, and that's exactly what the developer wants to tell the players. Do not focus on the destination only. Enjoy the music, enjoy the scenery. In our daily routine, we feel like coping with our tasks flawlessly, but sometimes we don't know what the goal is. Like I care about the rewards. The spirit of I don't know is the method to overcome OCD and the depression haunting us.
To estimate, the rate of OCD in Taiwan is about 2 to 3%. It's very likely that one day people around you were diagnosed with it. You have to understand OCD so that your classmates, friends, even your family members' OCD symptom can be alleviated. However, it takes steps and time to achieve the goal. In fact, the reaction of normal people to patients with OCD vary from person to person, and there are three typical reactions. People take the initiative to help the patient. People are unwilling to help the patient but can tolerate the OCD symptoms. And people don't want to help and allow the OCD symptoms to appear. The more you know about OCD, the more you can help treat it and make the disease recover more. You must learn to identify some abnormal patient's behaviors, including doing certain actions or things repeatedly, keep questioning self-judgment, take longer to do simple tasks, worry about little things or details, have violent emotional reactions to small things. It's not their personality, but the result of the disease. And if there's any progress, it will be rather slow. Here are some do's and don'ts to treat the patient. 1. Pay attention to the small progress of the patient. The patient may say, I'm back to where I started, even if he or she has made progress. Don't compare the changes of the condition day by day, because the course of OCD is ups and downs. Even if the patient has only a small progress, it should be emphasized and encouraged so that the patient's self-esteem and confidence can be gradually increased to overcome the OCD. Second, treat them according to the conditions. On good days, you can firmly assist the patient in resisting racial behavior or reducing his avoidance behaviors. On bad days, you don't have to act too much unless the patient's symptoms are already life-threatening. Maintain a normal home life routine. Try not to allow the disease to interfere with family functioning, as the routine and structure of daily life at home can reduce racial behavior and encourage the patient to engage in avoidable objects. Fourth, always remember to use humor to state the unreasonable aspects of the patient's symptoms, helping to reinforce the patient's ability to be reasonable. Encourage patients to take their medication regularly. Ensure that, whether he regularly goes to clinic to get medicine, whether there are side effects of the medicine, and how effective the medicine is.